warning everyone. We've got 3 symptoms here: common cold, mastoiditis, and irritation.
Those don't seem to be enough to make a definitive diagnosis, Hawks.
I agree with Leslie. There's not enough information here to pinpoint the illness.
Maybe, but I still think we should consider all possibilities before jumping to conclusions.
Well, we're doctors, so let's do our job. It's warfare and resistance.
I'm afraid you might be jumping too far ahead there, Hawks. The symptoms you've listed don't align with the ones for warfare and resistance.
Right, Leslie? I think we need to look at this from a more logical standpoint.
That's true, but let's not forget our patient. Dr. Leslie, can you perform a hysterectomy?
Hold up. You sure you don't want to try surgery skills?
If that's your idea of a joke, let's see if the patient laughs.
That surgery could be risky.
But Hawks, we don't need to resort to breaking into someone's home just yet.
Wait, we get to break into a house while Leslie has to stay and operate on the patient?
Want to trade?
No. I think it would be a good opportunity to show what other skills I have. You may continue playing doctor.
That's what I want to hear. Everyone get to work. I don't understand why you're questioning my judgment again, Tracy. I've been doing this job for years.
For one, where the hell is your new employee? Did they already break under pressure?
No, their doing on-the-job training is laid out according to the employee handbook.
Oh, is the training outside now?
Randall was showing her where the ambulances are and what each part of them does.
I would buy that if they didn't skip off in the opposite direction.
So, the security camera at the front of the hospital has been working this whole time?
As of the past few weeks. Yes, as part of security improvements you've begged for since Laptop Gate.
Alright, well those 2 will be back soon. I don't want Hannah getting too deep into the surgery part of the job yet.
You're making Leslie do all of that herself?
I would assume there's a surgical team she's leading. For all we know, she's putting up with Frank again.
The patient is in critical condition. I need to think about what the actual right treatment should be. God damn it. I hope Randall and Hannah find something at the patient's home that will lead us to the right diagnosis.
Fuck. That's a new one.
You've never dealt with a locked door before?
I've never dealt with a house that has a camera out front and a noisy dog inside.
Then we've got our work cut out for us.
In what way?
We say the noisy dog is causing all of the patient's problems. Let Hawks ignore all of it until he comes to his own conclusion at lunch.
I'll give you credit. Frank could never come up with a correlation that good.
You're a bunch of idiots. You nearly killed that patient. Warfare and resistance and hysterectomy. What were you thinking?
I was the only one who operated on the patient. How can he blame me?
For exactly that reason. Randall and Hannah, you better have a good explanation for all of this.
About the patient's symptoms or the fact Tracy caught us walking out the door on the clock?
The latter.
It's not like any of us had an idea that still worked.
Next time, go outside by the chapel exit next to the street. How that area has no cameras is beyond me.
What high crimes and misdemeanors go on at the non-denominational hospital chapel?
That's precisely what we don't know. Anyway, what did you 2 find at the house?
We failed to break in. But we did hear a loud barking dog inside that sounded pretty sick.
That's it?
Told you it wouldn't work.
That actually gives us a bit to work with. We may not have safe access to that dog. But let's brainstorm some possible illnesses that dog could transmit to its owner.
Interesting. I think it's...
But I have to go to lunch. Good luck. I've been thinking about my patient's case, and I think I finally figured it out.
Oh, really? What is it?
Well, from the symptoms you described to me earlier in your discussion with Dr. Patel, I believe the issue lies with a rare genetic disorder known as ectoderma pigmentosum. This condition makes the patient highly sensitive to sunlight and can cause severe skin damage. The unusual skin lesions on her face are a clear indication of this.
Xeroderma pigmentosum. I've never heard of that before. That sounds really rare, isn't it? Wait, who's Dr. Patel?
Gotta run. Good luck with whatever. You fools. You let your pride blind you to the truth. Warfare and resistance was a red herring, a distraction from the real issue at hand.
Excuse me. You can't just walk in here like this without proper protective gear.
Oh, and by the way, we have a new diagnosis. Nail patella syndrome. I solved it during lunch with Dr. Johnson. Not that it matters to you dullards.
Wait, how do you know?
Because I'm not just a pretty face, Leslie. I actually put in the work and do my job right.
What the fuck does that have to do with anything? Is that a poor attempt at flirting with your subordinate?
What's the prognosis for nail patella syndrome?
Oh, it's quite grim. The patient will likely experience severe joint pain, growth problems, kidney issues. The works.
Did the dog have anything to do with any of this?
Now, when Johnson was talking to Dr. Patel, I got reminded that nail patella syndrome exists.
Who?
You know what's wrong with you, Tracy? You're so blinded by your arrogance that you can't even see how I was, right?
What are you saying, Hawks? That you were somehow justified in making the wrong diagnosis?
I'm saying that if this hospital had listened to me first time around, none of this would have happened. None of it.
So now you're trying to shift the blame onto your team. I thought you declared the wrong diagnosis yourself.
No, that was Dr. Patel.
That's the rule of three, Hawks. Are you going to tell us who the hell that is? Both Johnson and Leslie were confused, and I could find no record of a Dr. Patel in this hospital system.
That saboteur probably erased them from the files, that fiend.
I can't tell if you're making up lies or straight up delusional.
Well, check every security camera. I'm surprised you didn't check if anyone busted into the server room to erase anything crucial.
Are you making up characters or security concerns?
Are you willing to risk it to chance, Liz?